Well, thank you to all of you for your welcoming remarks and for your insights and to kick us off and set the stage. I think our country is very lucky to have the lineup of leaders that you just heard from. And so we're going to move now into our first session, and I'd like to welcome Umair Shah back to the stage to share his perspectives on the Washington State Public-Private Academic Partnership experience. So,
I am going to be offering a presentation in just a moment, but I did want to start with mentioning a couple of people in the room. You just met Jennifer Layden. I was about to mention Jen, so hey, congratulations. Dylan George with CDC and the new Center for, well, I won't get the name right, but forecasting and something, outbreak analytics, all that stuff, that one. And wanted to really acknowledge Dylan and his leadership. And there are so many partners here that have made this a success. I also wanted to recognize our Department of Health team. And I had mentioned Dr. Brian Karras, who's our Chief Medical Informatics Officer, and Dr. Karras can thank you. Okay, he's got his hat. It's always the hat. And I did want to start by recognizing Les Becker, who's our Chief of Innovation and Technology. Les, if you can stand up. If you have not met Les yet, please, in the next 2 days, meet him. He is the most quiet, unassuming, humble person you will meet. He is brilliant when it comes to operations, when it comes to technology, when it comes to innovation, and when it comes to piecing everything together. He is the glue that keeps our innovation work together and moving. And so he will never say any of that to anyone, but he's right there, and I hope you will take the opportunity to really meet and visit with him. So thank you, Les. Also, I believe Lacey Fehrenbach stand up, and Dr. Tao Quan Get, stand up. These are on our executive leadership team with Lacey is heading our Office of Prevention, Safety and Health. And you have Dr. Quan Get, who's our Chief Science Officer, who's also leading our Office of Health and Science. I always get it backwards. So I want to just acknowledge Lacey and Tao as well. So thank you so much. And then finally, Claire Cutts and our innovation team. Claire is somewhere here. Claire, there she is. Claire, thank you. And they have done just such a tremendous amount of work to make sure that this next 2 days has been successful, but also the pre-work that goes into this. So the reason I say I want to always have the folks who do the work be acknowledged and stand up and for you to recognize them, because it is never about the me, it's always about the we. It's always about the people that you surround yourself with and work with on a daily basis. And they are going to be sharing some incredible thoughts over the next couple of days, but also it's important for you to know that they are the reason that our department and our state really shine in so many different ways, because they have put their dedication, their heart and soul, and their creativity and the passion and dedication into the work that we do. And so just can't say enough about them. So if you wouldn't mind, my Department of Health team. All right, we're going to talk innovation here. And so when we talk innovation, obviously you've got to be thinking about the Space Needle, and you got to be thinking about the ecosystem of what we have in this great part of the country. So we are very proud of this state. We're very, very, very proud of being able to share the innovation that happens here. But it happens across every community in this nation and across the globe. We just have to untap it. That is the key to this message. It's not about what's happening in places where you have lots of infrastructure and lots of interest. Yes, we share stories, but I'm going to challenge all of us, no matter where we are and the work we do, we can find innovation partners and public, private, academic, and community partners to really be able to move our work forward. And I think that is so critical for us as we look ahead. I also, in that vein, wanted to say that I did mention as I did the opening with our tribal land acknowledgement that we have 29 tribes here in the state of Washington, and 2 urban Indian health organizations that are fantastic at reminding us of the importance of community. And community is really where ultimately it's all about. And I know we also have some health directors here from some of our local health jurisdictions, and we have 35 incredible partners at the local health level that are innovative every single day in the work that they do. So it is so critical for us to remind ourselves that it is never any one group, it is all of us together as we move forward. So you can't see this very well, but I can't even see it very well, so I'm going to do my best to try to. Rainforest, we have the only temperate rainforest in the U.S. here. Dr. Ann Zink, we have the most glaciers in the lower 48. Yeah, not in the, well, north of us, but at least we will acknowledge the lower 48. We have apple, pear, and cherry orchards, which I don't know if Alaska has. Is that correct? You do have some? But not as many as we do. Okay, just saying. And I wanted to just share this one fact because she did say, just how, the largesse of Alaska, and, is trying to give all the, this is Seattle is the, we consider it our largest city and all that. So who knows if you are coming from Anchorage to Houston, where I used to be, what is the halfway point between Anchorage and Houston? Don't look it up. Seattle. Think about how big Alaska and Canada are to think that is impressive. So look that up. I did look it up. It is true. So, or at least Google Maps tells me it's true. Okay. So a great state, but we have to also frame where we are with public health. And this is for the folks in the room who are with public health. They don't need to be reminded of this, but I think it's important for our private sector partners that when we think of public health, it's this Institute of Medicine, the former National Academies of Medicine, National Academy of Medicine, that put this forth in 2003, and I love this. Is what we as a society do collectively to assure the conditions in which people. I keep thinking I'm advancing here, but I'm actually. Thank you. Yeah, thank you, Brian. I'm advancing here. I'm like looking at the slides. I'm like, oh, why are they not looking at this? But there it is. What we as a society do collectively to assure the conditions in which people can be healthy, and you can put in parentheses: secure, well, safe. And it's important, the word collectively. And I know that as we've come through this pandemic, we've had politicizing, we've had challenges, we've had rhetoric, we've had diatribe that's gone through the whole piece of what the word collectively means. But ultimately, that is what public health is all about. Next slide. We also believe at our department that health is this intersection of equity, innovation, and engagement. These are our cornerstone values. We affectionately call these the EIE values. It starts and centers with equity. We have to have the incredible importance of community in the midst of all that, but also thinking about innovation, not just technologies, but the people and the creative space to be able to have the creativity to do that work. And then certainly we can't do it alone. We can't have, I'm going to say this a couple times, silos of excellence, where we think we are so excellent, but we're siloed. And Angela mentioned this, and Ann mentioned this, and Jen mentioned this. All of us know that when we do our work, it has to be across the system. We've got to work together. Next slide. So we look back at COVID as a challenging time as an understatement. And I will remind us that while the emergency phase of COVID is over, we still have the concerns with COVID-19 even 3 years later. And that is so critical to reminding ourselves of why we must work together. In the middle of the response, we had a number of very innovative solutions that we had put together. Some of them were what we called Caravan, where these mobile units, you see the purple van there, I don't know how well it's showing up, where we were working with our communities to be able to help immunize people across the system. And what it was really about was to really galvanize the spirit of coming together, working with our local health jurisdiction, our tribal health, as well as working with our community partners. Our VAC Center, which was really the one that got highlighted quite a bit because it brought together so many private sector partners, and we had Starbucks, and we had Costco, and we had Amazon, we had all sorts of Microsoft and Microsoft Research. We had Google and Apple, and we had the Chambers of Commerce, and we had some of even the mom and pop clinics that were coming together. And what we did is we said we need to work together to effectively and efficiently vaccinate our population, but we also needed to do it with an equity lens. So we also had a collaborative that was called the VIX, the Vaccine Implementation Collaborative, which was 700 community-based organizations and end users, people, community members that came together and reminded us of the importance of community. WA Notify, which you're going to hear a little bit later, WA Verify as well. WA Notify was an app that we had on our phones all the way up through the public health emergency, where you would get essentially phone-to-phone Bluetooth technology to be able to give us reminders or alerts that we had been exposed to COVID-19 without ever knowing who the individual was. And WA Verify, which was an immunization COVID vaccine verification app that was developed in the middle of this response. We also had power providers. We had 70,000 healthcare providers that came together, doctors, nurses, other community health workers, et cetera, that came together to say we are part of the solution for vaccination. And then finally, Say Yes to COVID Tests, where we worked with AWS as well as Care Evolution to send out millions of tests to Washingtonians. And guess what? As we were working with the private sector, we got them there the next day. And one of the stories that I want to just share is that in the middle of our response, we had Governor Inslee, who had asked us to stand up 4 mass vaccination sites, and he said, I want them up in 48 hours. And we said, of course, yes, sir, Governor, we're going to do it. And we got them up in 48 hours. But lo and behold, one of our partners as part of VAX said to us, it's a little coffee company that you may have heard of, starts with a star and ends with a Bucks. And they came and they said, hey, we know that you have these mass vaccination sites up. Guess what? We believe very strongly that if we can get lattes and coffee in the hands of people 30-35% more effectively and efficiently across America and the globe, we know we can make your mass vaccination sites more effective and efficient. And guess what? They did. And so shame on us if we're not willing to take that public sector help, private sector help, but shame on private sector if they're not willing to offer that help and work together. So all of us have a responsibility to really work together. And so that was something that was so critical to the work that we did. Next slide. So we believe very strongly as the pandemic ends, there are 2 ways to see the pandemic end. One is to see it as we call as transactional, which is really looking at all of the things and really say that, look, it's one and done. It was just a one-time thing, once in a lifetime. We're never going to have another pandemic. Guess what? That's not true. We're never going to have another pandemic. Let's go to the next shiny object. Let's go to the next headlines. Let's just sort of wipe our hands and move on. That's transactional in nature. What we are trying to move towards and remind ourselves is that we must be transformational. We have to be thinking all the summations of everything we learn, good and bad, put it together and transform our systems, transform our partnerships, and transform our abilities to work together in the pathways that we must have. So next slide. And so I hold this up, and this is really, as you can see, our transformational plan at the Department of Health that we launched this last fall. Very proud of this. We can get copies of this for you. But since we're in the PNW, QR code. Yeah. Who caught that? Somebody in the back. Somebody in the back. Oh, you're not even. You guys are asleep back there. No. Somebody in the back. Yes? Take that phone out. QR code. Somebody, just put a phone up. Thank you. Woman in blue. Thank you so much. She's got her QR. I love it. So QR code. And what our transformational plan is really all about is advancing the priorities that we have across our state. So Governor Inslee said to us, and it's in our plan, I want you to reimagine public health. Reimagining public health doesn't mean we keep doing the same things the same ways. We've got to reimagine not just the challenges, but the solutions to those challenges. And so we have 5 priorities: health and wellness, health systems and workforce transformation, environmental health, emergency response, and resilience. And we're the first state health agency in the nation to have global and One Health as one of its priorities. That second priority of health systems and workforce transformation, that's what it's all about. All the other issues are issues, challenges that we've had and that we believe very strongly in, and we also recognize that we can't do that work unless we transform our systems and we have the people who are supported and developed, and we do everything we can to invest in their transformation and their abilities to be able to take on the technologies and the partnerships in true fashion. Next slide. So for us, it's not just a project or an initiative, it's a journey. And that journey has to continue, and it can't just stop because a pandemic started to fade. We must sustain this as we move forward. And so one of the things, and you can't see this very well, next slide, is that we've got a roadmap that we have done when it comes to technology and it comes to innovation. And started, as Dr. Monroe had mentioned, that we had the first COVID case in the continental United States. It was just north of us in Snohomish County. And we obviously had the first case, then the first outbreak at the nursing home, and the first death. And you fast forward, and to have one of the lowest death rates, the top 5 or lowest 5 death rates in the nation, is remarkable. But the way we did that was not just the epi response, and not just the infectious disease response, and not just working with our local partners, and not just working with our tribes, and not just working with healthcare, and not just working with the private sector, but it was also changing the way we, within our system, within our agency, were geared towards our response. We had to think about things differently. Remember, decisions that in public health oftentimes take months or sometimes years had to be made in days or had to be made in hours. We had times where, and it was hard because some of our partners said to us, we want more time, but we didn't have time. There was a press conference happening in an hour and a half, and we had to move forward with decisions. It was not an easy time, but to have this road is something that we have been on, the journey that we've been on, but the journey reminds us that we have to work together, and the journey must continue. We have to sustain even when the emergency starts to fade. Next slide. So what it means is that we have to have this cultivation of a culture, an environment, an ecosystem for innovation. I believe in innovation. Our department, as the EIE values, believes in innovation. Our leadership team believes in innovation. And that culture of innovation is where we are throughout our agency. We must infuse it as part of the everyday way of doing things. It's a challenge with how we're doing environmental health work. We have a concern today about reproductive health. We have a concern tomorrow about obesity and diabetes. We have a concern that we're going to have to take something on with maternal child health. When we take on any of those activities, any of the services, we must have this culture of innovation to really push the envelope. Next slide. And pushing the envelope, and this is where Les and his team came in, we last year launched something called Spark Tank. And so you may have heard of a show called something, so we're good at, by the way, it is good to kind of pull off and do some things. We pulled this notion of really a pitch session where we had ideas that staff members came up with, and what they did is they pitched it to us. And we as leaders then turned around and in a room, and we spent hours while we were watching the presentations, and the eye was towards coming out with projects that were both sustainable, investable, and an ability to really be pearls of wisdom and these circles of innovation to be able to spark talent and innovation across our agency. So I'm so proud of this process, and we're actually now in cohort 2. We were listening yesterday, and there was some conversation about, one of the projects, for example, was pollen identification and how pollen might allow us to look at a way for us to be looking at allergy and immunology within our system and an alert system for Washingtonians. So when pollen levels are up, we can actually get alerts on it. Very, very critical to how we advance health and wellness across our state. So innovation has to be a culture of people who are also being innovative. Next slide. And our priorities reflect that. And you really can't see this, but because I can't. But the overarching goal is to develop these strategies that empower innovation and the people to be able to do that work within agencies and then outside of agencies. And this is where I want to really recognize our sister agencies in state government, state health agencies. We have a Health and Human Services Subcabinet, which includes our Healthcare Authority, includes the Department of Social Health Services, our Department of Children, Youth, and Families, and even our health insurer, Health Exchange community that comes together, these agencies that we work so closely together. And I see Dr. Fatinos here with our Healthcare Authority, our Medicaid Director. There you go. All right. And we are working together with our partners, so we can't do it alone. When we work with our Health and Human Services Subcabinet or Cabinet or Department of Ecology or Department of Transportation or Commerce, we've got to be working outside of these silos of excellence. We've got to work together. Strategic partnerships absolutely means that we have to work at strengthening the health systems infrastructure. That is public health and healthcare. And Dr. Zink and Dr. Monroe just talked about this, of the importance of both of them coming together, and we have to integrate what's happening in the emergency department or the clinic or the hospital has to be integrated with vertical, diagonal, and horizontal integration across the system. And then transformational planning, again, has to be intentional with the EIE values, and we have to make sure that the solutions to everyday problems are absolutely about sharing across the system. Next slide. So we must leverage these partnerships, public, private, academic, and community partnerships for the advancement of the health of the people that we serve. And we're all a part of that. That's what makes public health and population health so cool. Because when you raise your hand and say, well, who's a part of public health? It shouldn't be that our private sector folks say, it's not me, that's them in government, or that's them in public. We're all a part of the public. All of us are part of it. We all want to see our communities thrive. There's nobody that says, gosh, I wish I were in a community that was just, not thriving and dilapidated. No, we want all of our communities to be successful. And I think that is a critical piece for us. Next slide. So why is that critical? And these, by the way, there are a number of partners that were added after the fact. And I want to say that some of these partners are in the room, aren't even listed, so I apologize. I want to say there are so many partners that come to the table. So many partners that it may be about this issue or that issue, but they come together for the importance of working together. And so I can't say enough about our sports teams, right? So our sports teams, for example, are such champions for health and wellness for their athletes. What about what's happening for the fans, right? What about the people they can reach? When you look at rideshare apps and you start to say, well, these are rideshare apps and we can get people from here to there or goods from here to there. Well, in the middle of COVID-19, we were trying to get people vaccinated into appointments. And the rideshare app companies, they stood up and they came to the table and said, how can we help you? So I can just go on and on about a number of the partnerships that are here, but just know that I want to just recognize that we all must work together. Those who are on the slide, those who are not on the slide, and all of us together, because we have to lead with partnerships and leading across the system. Next slide. And engaging academia. I know Janet had made this comment earlier about the Dean Godwin, who is, their group is just such a tremendous asset to us here in Washington, at the University of Washington. And I will say that we're also working to look at our workforce, because we've got to develop that workforce. We have had so many of our public health workforce who have left. the field. They are no longer in the field. In the last several years, we've seen a third of our workforce leave, and we believe in the next 3 to 5 years, another third of our workforce is going to leave. It's happening at our state level, it's happening at our federal level, it's happening at our global level, it's happening at our local, it's happening at our tribal and our regional level. We've got to do everything we can to increase that pipeline. So the good news is when you talk to Dean Godwin, she says, yes, enrollment is up in schools of public health, and that is happening across the country. Great. But then when we look at our workforce and we look at the people that are trying to get into, especially the governmental public health workforce, there's a disconnect because they're not. And so we're having conversations with some of our local partners, especially in our rural communities. They say, we have monies, we have the dollars, we've had investments, we can't find the workforce. They're not there. Now, that's a partnership opportunity, it's a workforce development opportunity and a recruitment opportunity, but it is also a technology opportunity. So think about how do we work together, and we have this Pathways program that is now really bringing the next generation of public health into our system so we can move forward and really allow our team members to be inspired by the next generation of public health. We have to have more programs like this, and I want to applaud the CDC for the work that they've done to get infrastructure grant dollars out that have really helped so many departments across the country. We have to do more of that. Next slide. And I'm almost done here, so Dr. Monroe, don't worry. I know I'm cognizant of time. She's got her laptop ready. She's like, okay, get off the stage now. Angela, I'm almost done. Oh, okay. All right. Janet, I don't know. Who's next? I don't know. Whoever's next. All right. Somebody's next. All right. Well, the one thing we didn't calculate this morning is who's next on the agenda. So that part we're going to have to work on next time. Key takeaways. Public-private academic partnerships allow us to go further together. We can do the work in silos, but when we do the work together, we actually go further. And I think that is such an important part of this. The other is that leadership and intentionality matter. But, I keep wanting to make sure, there they are. All right, just roll through all of them. Yeah, thank you. I was like, where are they? Leadership and intention. Whenever Tony walks up, I know I did something wrong. So now that Tony's walking back, I feel like I'm still in good. Okay, thank you, Tony. Leadership and intentionality matter. So we have to have leaders who scream this from the mountaintop. It can't be just coming from team members. It has to be at the top. The CEOs and the C-suite, as well as the leaders in public sector, all of us must be saying that we have to work together. And then we have to be intentional. The investments, the pathways, the structure, and the culture, and the investment in people to be able to make sure that those partnerships are happening across the system. We have to incorporate fresh approaches to these everyday health challenges. Health impacts every one of us. How many of us were able to work successfully when you had a family member who had COVID-19 and was either in the hospital or at home and you were taking care of them? How many of you were able to work successfully or as effectively and efficiently when you were taking care of a loved one, right? Or if you yourself were sick. Health impacts all of us. So we all have a responsibility, not just for our health, but the health of others around us. And we have to bring those fresh approaches. And then, Dr. Monroe mentioned this, federal, state, local levels of interconnection. The work must be in unison to advance the partnership opportunities. We've got to be on the same page. If we're not on the same page, we're going to have chaos, and people will then say, well, the federal government's doing it this way, locals are doing it that way, states doing it this way, tribes are doing it this way. It doesn't work. We don't have to be the same. We have to be consistent. And I think that's a key message. And then the key challenge is coming together during times of non-crises. And of course, Dr. Monroe has already stolen my thunder because I call those Blue Sky Day. See, we had it in there. It was already in there. So look, private sector partners, we love you. We love it when you're here. We love it. We love all the work that you do. But let's remember, it's not just about a crisis. It's not just about an emergency. When COVID-19 happened, everybody came together because it impacted all of us. But what about Blue Sky Day, when it's not an emergency, when you have the bottom line to meet, when you've got shareholders or people who are saying, or your boss who's saying, I need you to do X, Y, or Z, how do we work together to be able to make sure that those activities are robust and partnership savvy? Next slide, and this is my second to last one. I wanted to just announce that today, Dr. Karras has told me this, that at HIMSS, the Health Information Conference, has just awarded, or will be awarding Washington State Department of Health as one of the leading innovators in digital applications for improving public health as a 2023 HIMSS Public Health Davies Award recipient for its WA Notify program, which you're going to hear more about. Again, we had 2.5 million exposure notifications that came through the system. People who didn't know each other, but they were around each other, and they had an exposure notification, and this system worked. I will tell you, I was in, I went from SeaTac to O'Hare on the way to Baltimore at a conference. There were only maybe 3 or 4 Washington people that were at that conference. And I got an alert when I got back for the time I was in Baltimore, and I thought, well, that's odd. And I knew the people that I was around, and I tried to check around and, hey, did you have COVID-19? And they were, no, 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 no. Turned out that one of the people that was at the conference, I met after a red eye at O'Hare Airport. And I was there with this person for about 10, 12 minutes. That was it. Didn't see this person the rest of the conference, the rest of the trip. Our phones talked to each other. The Bluetooth enabled, the alert system worked, because guess what? This person, a few days later, announced that, hey, I have COVID-19 and I want to make sure that you get tested. The systems work if we allow them to work together, and so we have to be able to do that. So again, just really proud of that WA Notify, and thank you, Dr. Karras, for reminding me of that. Next slide, and we'll just close with just saying that this is the flag that Governor Inslee had put up on the Space Needle when we were reopening. Washington ready. We are absolutely ready. The public sector is ready. All the people in this room and beyond are ready. Our country is ready. We have to take the next steps, and we have to work together. Our leadership team here, a few of them, as I mentioned, Les and Tao, as well as Lacey, and Chris Holliday, our strategic partnerships, right there. Chris, thank you. I knew I was missing somebody, Chris. These are new areas in our department. We've had science, we've had prevention, areas of partnership, innovation, new ways of communicating equity. The work that we do is really advancing, as well as our new division that we're going to have of Global and One Health. We're going to call it Global One. So we're really excited about that, and we're recruiting for that leader. So I just want to say thank you so much for being here today. I'm looking forward to the conversation over the next 2 days. And I really want to recognize also, ultimately, that what you learned today and tomorrow, let's hope that that conversation continues for the future, because we have to be able to do this work together. So with that, thank you so much.